Tonight on Doctor's Diaries.
This is a woman who fully expected to die. She would say things like, all I want to do is live through the summer. That was 3 years ago.
But to see a baby bleeding, this is the real stuff. We all know when we see that, it's not grape juice. That's somebody's kid.
I look them in the eyes, I hold their grafted hands in my hand, I look at scar tissue on their neck, and I'm proud of who they are and what they look like.
She was on her deathbed. They gave her back to me, and yes.
Rounds were very good.
For the last 14 years, Richard Schneider, critical care nurse, has been working in the burn unit at Westchester Medical Center.
10 a.m. medication, only 5 minutes late.
Oh, 5 minutes late.
Write me up.
He's been caring for Jane Kreeger ever since she rescued her granddaughter, JC, from their burning home.
Call him boy.
Oh, boy.
47 years old, no boy.
He comes in with these horse pills. He decides on horse pills.
This is the mild tranquilizer you're on. And the other one's a routine medication. That large pill is actually an antibiotic.
This is the man that's taken excellent care of me. Excellent.
Let me bask in my 15 seconds of fame.
It's true. He has a heart of gold. He's compassionate. He does whatever he can for his patients and then some. Most people will give 90%. He gives 150%. And that's what makes you get well. That's what makes you get well.
They went to bed one night and woke up to a house full of smoke and flames. I'm sure they didn't think that this is what was going to happen. Jane, to me, is a hero. She grabbed her granddaughter and walked through fire to get her outside.
Nobody knows how the fire started, but Jane's daughter, Crystal, who's deaf, was the first to wake the family.
I woke up and there was a fire in the corner of the room. There was next to the baby. I was very scared. And I went to the crib to look for the baby and I couldn't reach in the crib. And it was black. I couldn't breathe.
How did you know where the baby was? Did Crystal tell you?
Crystal told me that she was upstairs. She was in her crib. When I got upstairs, all I could see was yellow flames all surrounding the back of her, and she was in her crib and she was crying and screaming. And I just picked her up, didn't hesitate, didn't think about anything, just started doing what the Lord said to do, and that was to walk down the stairs. They're old stairs, you know, they're not wide, you know, so you have to be careful walking down them. And I was being very careful, holding on to her, almost counting the stairs as I was going down, to make sure that I knew when I got to the bottom without falling.
Jane got her granddaughter out, but just barely in time.
I really don't see you clearly, although I know what you look like.
Right.
I don't see much down here except for the whiteness of the coat and no details.
What are you talking about? It's a brown coat.
I know it's a white.
Dr. Harold Horowitz is treating Nancy Ayala. She's been living with AIDS for the last 7 years.
This is a woman who fully expected to die. She would say things like, all I want to do is live through the summer. That was 3 years ago.
Dr. Horowitz, an infectious disease specialist, is the director of the AIDS Care Center at Westchester Medical Center.
In terms of our primary care patients, the people we are most directly responsible for, those would be the HIV-infected patients. And we do an awful lot of work, both clinically taking care of patients as well as research. The real miracle of our field has been with HIV, where we used to see our patients, you know, every day someone was dying. We rarely see a death now.
Dr. Horowitz has been treating Nancy Ayala for complications associated with an HIV infection. The virus destroys her vision and threatens her life.
When I close my left eye, and I look up my right eye, I can only detect light. that's because that's all the vision I have. I can't detect anything else.
And she suffered through severe depression at various times, all kinds of social upheaval, and she's still an active, participating mother. It's wonderful.
At home, I live with my eldest daughter, 24 years old, and I have a 10-year-old who was initially 3 when we started working with Dr. Horowitz in the AIDS management group here. Since then, I've gone through...
You never bring the 10-year-old in?
She's in school, thank God. She's doing good.
Great.
She thinks about you all the time.
She began treatment at a time when we didn't know what the hell we were doing.
No, nothing's growing except the pain here and you know, the anticipation of losing the vision, which we were all prepared for, and thank God that we were able to delay that.
No, it's extraordinary what's going on. Extraordinary.
Thank you.
Dr. Roger Salisbury, plastic surgeon and director of the Burn Center, is about to attempt a skin graft on JC's hands.
I don't mean to waste it. Can you have the bed up, please?
Twice near death, JC is finally stable enough for the crucial surgery.
She got burn on her face, which is aesthetically just such a difficult situation for a boy or a girl. And then she got burned on the most functional part of her body, her hands. This is somebody's baby, and this is what they have to deal with. This is a lifetime. It's a lifetime problem. This isn't going to go away tomorrow. The vestiges of this are forever. And her hands are never going to be normal because the burn is at least 3rd-degree burn. You were in the operating room. It's hard for me to look at it through your eyes. But to see a baby bleeding, to see those kind of dressings, to understand what's under those dressings, that's worse than a Jack Nicholson movie. I mean, this is the real stuff. This isn't something that's fabricated. We all know when we see that it's not grape juice. That's not cranberry juice. That's not somebody playing at being sick. That's somebody's kid.
Yes, I'm Linda Major. Okay.
Linda Major is a nurse at Westchester Medical Center. Today, she's checking herself in as a patient.
Yeah.
She's already been diagnosed with a number of fibroids in her uterus, and as her condition worsened, she was offered a medical solution which she did not like.
I could have chosen to have a hysterectomy. I do not plan on having any more children. I am a grandmother. However, it is still the issue of major surgery.
First one is consent for treatment.
So I went for my checkups, and the gynecologist had said that, yes, a hysterectomy would be appropriate due to the constant blood loss. Then when it came down to the nitty-gritty, and I'm thinking, oh God, I don't want to have general surgery. I can't deal with being out for 6 weeks. There's too much going on with the job, and there are too many changes going on, and it's like, I can't handle it.
I'm gonna make a right,
And
down the corridor, last door on the left.
And one of our nurses here reminded me of this procedure, fibroid embolization, and said to me, Linda, why don't you check it out?
Linda hopes a fibroid embolization will end her intense pain and blood loss.
It turns out that one of her colleagues, one of the nurses that she was working with, used to work with us in interventional radiology. So she knew about the procedure, she was involved in several of the cases, and she referred her to me. And that's how we met.
How are you?
How are you?
Good.
My name's Christina. I'm one of the nurses here. I'm going to take you in the back and ask you a
Hi.
few questions.
So she was good enough to call him up, and he came down and spoke with me at length over this procedure. Oh, there he is. Kim! Hi, it's me.
How are you?
How you doing?
When you work in the same hospital.
Oh, you work here?
Yeah.
Oh, God, I'm
one of the
sorry.
transfusion nurses.
I didn't know that.
She didn't like the option that was given to her, that being a hysterectomy. She wanted to keep her uterus and felt that it wasn't a sick uterus. She had this benign tumor in it. She wanted to keep it if possible.
Thanks. Oh, Kim, I'm so glad you're there. I didn't know you were going to be there.
Dr. Poplawski has ordered an MRI of Linda's uterus. The results will determine whether she must have a hysterectomy.
Great, you okay? Yeah. I know that's the hardest part. I told you it was going to be a squeeze, right?
The last two staples, Gene.
Nurse Richard Schneider knows that for burn victim Jane Kreeger, the slightest touch can be excruciating.
Bend your hand slightly. Perfect. Just gonna pat them dry, Jane. Gently.
How do those knuckles look? Still yucky.
A little bit.
You wanna try scarlet?
Yeah, I was gonna say some scarlet red, because I think the graft is there.
It will take Jane a long time and a great deal of work to regain full use of her hands.
The reason I do this now, and I know it may be a little uncomfortable, but if you heal over it, it'll end up a little abscess and you'll lose part of the graft where it comes out. So I just want to make sure that there's just nothing hidden in any of this regular looking stuff here. I don't feel a thing.
How's that hand working? Left one in particular.
What? One in a cast.
What?
They've had that one in a cast. I just took the cast off.
All right, so impress me with this one.
I've been doing a lot with this hand.
You wave bye-bye?
Yeah.
Yeah, let's see you do this. Oh, come on!
I'm telling you, that's it.
Ah! Looks like we got some work to do today. Moving! Gotta get you home. Right?
Don't hurt me.
Hmm?
Don't hurt me.
If you make a fist, you can hit me.
I'll have to get that one back in your room. There's a piece of tape in there too. I'll bring it with you. You wheeling or walking? Try walking.
Richard, he tries to crack some jokes to lift your spirit. So a lot of times you're focused in on what you're going through, you know? He tries to distract your mind, and that helps. I had the best care possible, and JC has had the best care possible. And I couldn't be any more thankful. Any more thankful to them. There's no way that I could ever repay them, except to say to them from the bottom of my heart, thank you. And I love them all. And I always keep all of them in my prayers. All of them.
Not like I want to give you one, but okay. So I'm going to ask you a few questions.
Okay.
Okay. Why are you here today?
Okay, I'm going to have a fibroid embolization.
Okay.
And
And why are we doing this? Because you have uterine fibroids?
uterine fibroids, heavy menstrual bleeding. I have to keep going. Okay, I'm not a nurse, I'm a patient now. Yeah. So I let them take over. Yeah. Keep my mouth shut.
Dr. Poplawski and his staff review Linda's MRI. They will decide if she is a good candidate for fibroid embolization.
How do we look? Are we a go?
Good. No adenomyosis. You have multiple fibroids.
Yeah, how many?
You have at least 3 of them. One of them, which is probably causing you the bleeding, is a submucosal. You have one that's submucosal, and that's probably causing you bleeding. She pretty much understood exactly what we were doing. When I speak to most patients, I talk to them. I try and speak in layman's terms and regular words. And I hope she didn't feel I was talking down to her, because she does. She's very knowledgeable, and she knew exactly what was going on. Plus, she did a lot of research. We'll go over everything again upstairs right before we do everything. Okay.
Okay.
And that's pretty much it.
Cool.
Okay? All right, so this was good. I'm going to leave this with you, so we'll have it when you come upstairs.
Okay.
And we'll get you going probably in the next 15, 20 minutes.
Great.
There is definitely a role for hysterectomy, for cancer, for things like that. But there are a lot of very uncomfortable risks involved with hysterectomy. So to have this procedure done, if it works, like I said, 90 or 85% of the time, great. If it doesn't work, well, you don't really lose that much because you could still have the hysterectomy. We're going to bring you in the room. We're going to do the procedure. We'll give you some local anesthetic here in the groin, place the catheter up in the artery, inject some dye, take some pictures, then place the catheter in the artery that goes to the uterus. When we verify where we are and we see the fibroids, we'll then start plugging up the artery with the Ivolon. That's the little plastic spheres or balls that go in, plug up the artery, and prevent the blood supply going to the uterus and the fibroid, and then the fibroid dies. Okay. Once we do that, you're going to start feeling some pain. Okay. The pain is anywhere, as I told you, from your period, like it would be a crampiness, to giving birth. Okay. Now the pain is the worst for the first 6 hours. After 6 hours, that's when it peaks. It starts getting better after that.
Any history of any problems with these spheres, the polyvinyl?
No, see, we've been using this for over 20 years.
Okay, that's what I want to hear.
For more information, log on to our website.
Okay.
5 days after JC's skin graft operation, her hands are doing well.
Okay, this is her donor site actually. This is where we took skin from a while ago and put it to her hands, and that was the first stage of skin grafting she went to. This is all nice and healed actually, and while it may not look nice to some people, it sure looks a lot better to us than what was there. And this will heal over and she'll have some scarring there. She does have a small area over here that still needs to be worked on. We might need a graft there. My feeling is it'll probably heal.
She looks much better today. Much better. What a relief. So much swelling has gone down, and I actually could see her little eyelashes moving today.
It's nice when they get their face back, isn't it?
Yeah.
Same for you. You were pretty puffy there for a while also.
Guess so.
You got your eyelashes back.
Yeah.
So they had all of their belongings packed up. So fortunately, the pictures were packed and they survived. So they have this. Just before the fire, it was taken. She's just so beautiful. You could see her personality in that picture too, I think.
Oh, that's how much pain I'm supposed to be creating myself? Okay.
Relax.
Okay. Once a day? Oh, God.
6, 7, 8 times a day.
When somebody's disfigured, they're only disfigured on the outside. It hasn't changed the person inside. We're all people, and I don't view person's beauty or person's worth on the skin itself. I look at them and I know what they've resolved. I know what pain they've been through. I know what separations they've suffered. Almost healed. The hairline's coming in.
Got a haircut?
Oh,
You noticed that? Yeah, I noticed it. You wearing real clothes?
Real clothes.
I'm proud of you. It's not easy, honey. I know.
Thank you for your great care.
It's not what we're talking about. Getting well is hard work. I rush to certain patients. They should have died in the hospital. They're home, they're living, they're laughing, they're with their parents, they're with their families. I run up to them and I put my arms around them and I hug them. I look them in the eyes, I hold their grafted hands in my hand, I look at scar tissue on their neck, and I'm proud of who they are and what they look like. And it doesn't bother me at all. And we've had some very disfiguring facial injuries.
JC, look.
JC has been in the hospital for over a month. She's 1 year old today.
She looks a lot better today than she did yesterday. Her eyes were opened, I guess, even before the movement. But once she opened her eyes wider, a lot wider.
Brandy, that's you.
Fine, come sit up here. I'm gonna take one of your 18 coats off. Or 2 of them. Why don't I have...
It is now 3 o'clock, and Dr. Horowitz is treating Eugene Schaefer at the AIDS Care Center.
Now, where are we at? Okay. You're not taking anything?
No.
Okay, lie back. Oh, you stretch
feel
down.
good.
And you're feeling great?
Yeah.
You like not taking anything? Well, I don't know what to... Well, we have this... Every 3 months we have this conversation. I don't know what to tell you. It's a very complex issue of why some people will take their medicines and some people don't take their medicines. How do you have a person take 50 pills a day, 40 pills a day? It's 5 different intervals. It's extremely difficult. So just tell me, why do you don't want the HIV medicine?
It's a pain in the ass having to take that many pills every day. It's like 32 pills, 16 in the morning, 16 at night.
This patient has not been on any medication. None. 0, never, ever. Refused. I've given up on him, but I'm looking for indications for when I might push him harder. You know, in this doctor-patient relationship, there's an awful lot of manipulation that goes on. Some of it politically very correct and some politically very incorrect. You still want to stay off that stuff?
Yeah.
Right. Fortunately or unfortunately, in most situations, the physician or the healthcare provider is going to move an interaction where they want it to be. And you can press harder, you can press less. You can describe in vivid detail to the patient what will happen to them if they don't take their medicines, and that might push them subtly to take their medicines. Taking this medicine will prevent you from getting toxoplasma, which you are antibody positive, which means you've been exposed to this organism which is found in raw
Take
meat.
the vaccine every other day.
Right, or even just Monday, Wednesday, Friday, less than every other. That's easy to remember sometimes. Excuse me, Monday, Wednesday, Friday. If you could take that, would be great. He is a walking time bomb, and he's done still remarkably well with the disease. Look, I mean, this is a guy, we were talking sports. He knows everything what's going on. He still shoots 3 racks or whatever he said, number of racks at the pool table. He's got his coordination, he's got his memory, so he's not doing particularly badly. All right, come on in with me. Keep up the good work and reconsider the therapy now. Okay.
It's been 36 days, and Crystal will finally get to hold her baby.
Oh, I got it. Oh, no, it's coming out. We're going to bring a chair around, Crystal, so you can sit with her. Oh, she's throwing up.
What's she throwing up?
Okay. She's crying so hard.
Okay, all right.
Oh, here, there. Can I get a blanket for her? Yeah. Okay, we want her head to tip back just a bit. Okay, so I can put it back on the bed.
Okay.
All right, Jess. Okay, baby.
I'm getting nervous.
Don't be nervous, she's fine. She's crying, that's all she's doing. She's totally fine. Aren't you, JC? It's a little different to see her cry when you can't hear her. But that's all she's doing is crying.
Casey, what are you doing?
it just seemed like a big moment, and I had new film on my Polaroid camera, so I thought I'd take a picture for them to have. Just sort of, this is the start of good things.
You're smiling at me a lot. You must be resting well at home.
Try to.
You getting your sleep in?
Yeah.
Where are you staying? Your sisters? Sister-in-laws? Yeah.
It is a very satisfying job to see people who you've helped to regain the sense of survivorship, that I can go on from here and I can build from this injury. And we do survive a very high percentage of our burn injuries.
Dr. Poplawski is about to begin the embolization to remove Linda's fibroids.
Yes, I'm a little nervous about this because we're still invasive in the sense that it's a femoral artery. However, I'm very happy I'm not being cut. I'm not having general, I'm not having general surgery.
We give some local anesthetic over the hip. Usually it's the right hip. And we use a needle to enter the artery that goes to the leg. That's the same artery that goes to all the organs in the pelvis.
Oh, weird.
What's that?
My hip?
That is your hip, correct. That's your right hip. We place a catheter, or it's basically a big straw, into the artery, and then we inject the X-ray dye.
Where are you snaking through?
Well, right now I'm going down, I'm going up the right leg, and I'm going to go down the left leg.
Really?
Yeah. And the X-ray dye, we see it on the monitor as kind of like a road map. It makes a map of all the vessels. Inside of there, so to start making it denser. We can use different techniques, wires and catheters, to place that catheter, straw catheter, into the artery that goes to the uterus. Once we're in there, we inject dye to verify where we are and that we're in the correct artery. And then once we know where we are, we then inject the particles. You're gonna start feeling some pain. I'm not a sadist, but actually I like to see pain in the patient, because that tells me that it's working.
Yeah.
The fibroid is dying.
Right. That heavy.
It's a heavy, it's
Yeah.
It's a pressure,
yeah.
heaviness. It will get worse, okay? I'm letting you know now.
Gee, thanks.
Gee, thanks. See, that's what I get for taking care of nurses. They help you. You're not leaving me taking away my thunder. After that, once it's all done, we take the catheter out. That's it. You don't see the artery anymore, right?
Yeah.
The artery, we're all done. How do you feel?
Okay.
Good.
I expected more cramping.
The truth be said, they're not in the mood to get up and walk around. Usually they have a significant amount of pain, and for that reason we give something called a PCA pump.
Oh, Jesus.
Okay. That's a little pump where a patient's given morphine, and they push a little button, and then that delivers the morphine.
Yeah, you're feeling the pain now, boy.
Oh, okay.
And there's a special computer that allows them to take as much as they need up until a certain point. At that point, it locks them out and doesn't let them take any more. So you don't have to worry about overdosing. Give as much as you need. If you feel the pain, give yourself a little squirt. You don't have to be worried about becoming addicted. It's only less than 24 hours.
Yowza. Oh.
The one good thing about the pain, at least you know it's working.
Oh, I know. It will end.
And it will end, yes. Mm-hmm. Oh, okay.
Mommy. What?
Hope is 10 months old. She was born with a life-threatening heart defect.
For what she's been through, she's very content, but that's because she's very loved and very, very much loved and wanted, right? Yes. Give me a kiss. Give me a kiss. No kiss from Mommy?
Hope's mother, Bridget Bruzuela, has seen her through 2 open heart surgeries and countless medical procedures.
You don't understand. She was on her deathbed. They gave her back to me. And yes.
Hope is one of my patients, so I'm her primary heart doctor. She's a small baby with a serious or large hole in her heart when she was very little. If this is a typical heart with 2 major valves here, and this is a wall here and this is a wall here that divide the 2 top chambers and the 2 bottom chambers of the heart. She was born with a heart defect that actually had a deficiency both in the wall between the top 2 chambers as well as the wall between the bottom 2 chambers, so she had this huge hole in her heart.
Hope was given an artificial heart valve and a pacemaker 7 months ago.
Do you want to see her scar?
I mean, I spoke to her yesterday.
See, they don't know what you really look like. If they'd have seen you, they would say, this is not the same baby. Oh, sorry.
And they're sleeping.
Cover that. Don't show them your belly. I mean, she's good. I don't know many adults that would go through what she's been through and still have a nice disposition.
So Hope isn't having a surgery. She's having a procedure, a diagnostic procedure called a cardiac catheterization.
They're going in to check because she's still, I think the right side of her heart is still a little bigger than they would like, I guess. And they're going to check on the work they did and her aorta. She has a thinning of the aorta. They're hoping that will correct itself without any surgery for that, but they're going to check it all out and let me know. I'll be a nervous wreck, and that's why I won't leave. I promised her I'll be by her side, and that's what I will do. I'm not as nervous because I have a lot of confidence in the doctors.
Usually there's no complications. Minor complications that occasionally occur can include blood loss or an infection. Very rare complications that almost never happen, but we often need to tell families are injury to the heart or the electrical system of the heart from trauma, from manipulation of the catheters and wires within the heart. Worst case scenario would be puncture of a vessel or the heart, which might require urgent surgical repair.
Hope's hands are bandaged so she cannot pull out her intravenous tubes.
Yes, I won't leave her. I think it's important, if you can, to do that. I really do. She knew, even when she was in the comatose state, she knew I was there. Because when I would touch her hand and talk to her, her blood pressure and heart rates on the monitor would go.
Linda Major has been in the hospital for 24 hours. She hopes to go home today.
I'll have to mention that to him. Dr. Poplawski came in early. He thought I was doing terrific and said he'd have someone take the Foley out, which I honestly was very glad that was in last night because of the cramping. It was just, not easy to move. I couldn't even find a comfortable position, other than flat on my back. So it was like when I was stuck flat on my back, I could hardly wait to bend my knees. When I could finally do it, I was like, oh, I don't think so.
I'm just going to leave that this in, okay?
Oh, thanks.
And they're calling for a courier for the wheelchair.
Okay, great.
Take care.
Thanks. And yes, you still get cramps. Oh.
She's great. She's got a great personality. She's a lot of fun. She was a very good sport. It was okay. Just a little more pressure, just knowing that we'll see her. I'll see her periodically walking in the hallway, and that's someone I really want to get a good result on, just because I do see her every day.
Hope is ready for Dr. Marcus Erb to perform the cardiac catheterization that will determine the condition of her heart.
do enter the body and the heart by vessels, usually in the groin. Usually an artery and or a vein can be entered with a little needle, and then once you get the blood showing that you're in, you can take very long wires and catheters, and they can be advanced into that needle hub and up to the vessels that connect to the heart, and then you can get the tip of those long wires in the heart.
This is often the longest part of the procedure on kids like this. This is by far the most tedious part. It can get very frustrating. There we go. That's it. Okay. 74, excellent. 73, 74, let's see. Oh, that's a funky wedge. Is that the wedge? Yeah, it certainly looks like the wedge. Well, that's not a happy thought. Well, this basically means that the pressure in her left side of her heart is much higher than we had hoped. Meaning that there's most likely restriction at the valve. All right, can you do me a favor? Can you call 7896 and ask them to page Dr. Say-2 to here?
Room 1. Yes.
All right, where is he? Is he? Oh, I'm just talking for a second. Hold on. Hey, Gary. I got your patient on the table. Numbers aren't good. Numbers are not good.
He called to let me know that he had performed most of Hope's catheterization and somewhat surprisingly was finding fairly elevated and abnormal pressures within different parts of her heart. We had suspected there might be some abnormalities, but perhaps not to the same degree.
Inject! Well, that answers the question. So I think she's going to need surgery on 2 counts, but she's not going to be able to wait much longer.
Yeah, she's got nipples right here in her drawer. She's got her own bottles.
Bridget is waiting to hear Hope's results from Dr. Say-2. The news is disappointing.
We always knew at some point, but I think that there may be evidence that now, more than later, is the time to do something, so we'll see. What we found was that the pressure in Hope's left ventricle was a bit elevated. She has the smallest possible artificial heart valve that could have been placed in that position. That still is usually too big for a small infant, except we don't have anything better. So you kind of know the routine. It's really the reverse of what was before.
Unfortunately, yes, I do.
Is there anything else I can help with?
No, I'm just sorry that everything you've prepared me for. I mean, I was hoping he would come and say, guess what, we didn't find anything.
Yeah.
Take her home, see you next year.
Yeah.
Oh, yeah. Okay.
But I'm on this weekend, so if you're around, I'll see you.
Okay.
Okay.
Okay, bye-bye.
Bye, sweetie. Bye, sweetie.
Now, where did you get that hat, dude?
I've been had a good while.
That is a funky hat.
Yeah, thank you, buddy.
And who you rooting for, Yankees or Mets?
I've been a Yankee man all my life.
It is 5 o'clock at the AIDS Care Center, and Dr. Horowitz is seeing his last patient of the day, Eddie McDowell.
Yeah, I'm going to make you pissed as hell.
What? The Mets.
I turned down 4 Yankee tickets tonight.
Oh, man.
That's right.
Oh,
I got to go look at schools with my boy.
Yeah, no, I hear you.
Well, I don't know if I hear myself on that one. he's not real happy. He says, Dad, you're off the wall. I want to go with you. Good, you're doing terrifically, Eddie. Just a very funky old guy, isn't he? I love him. He's over 70 years old now. He's 70, something like 71. who was first diagnosed with this in 1991. That was 10 years ago, and he's never had low CD4 cell counts, meaning he's never been, one, at risk for opportunistic infections, and he's never developed AIDS. That's amazing. You know, as you're aware, you were diagnosed first, from what I remember, with HIV in 1991.
That's correct.
And you first got to know us in 1998. And I've been following you actually almost 3 years now. We know each other.
Right.
And you've never taken any antiretroviral medicine.
That's correct.
And why is that?
I've been so healthy all my life. Being a sportsman, I've been very healthy and lucky.
How old are you now, 45?
71. Okay.
No, your viral load has been up at 61,000. It's now 28,000. Your CD4 has varied anywhere from 510 to 1,600. It's now 650. And this is saying that your body is, for the most part, taking care of the virus. And I don't know. I could knock the viral load down, but the toxicity may not be worth it at this time. For whatever reason, his immune systems or the virus itself that he has is such that it's fighting off the virus. We don't know exactly how that happens. For all I know, he will live out his life naturally without any problems related to the HIV. That's great.
I'm doing better than I thought. See, the older I get, the better I get.
It's true. This is terrific. It's very easy to get very confined in who we deal with in our lives, in our community. And it's almost a vicarious experience by talking with these other and trying to help these other people. And I enjoy it, and I think they enjoy coming to the clinic. We have our people do come back pretty well.
For more information, log on to our website.
And when I see her looking the way she looks today, you can't even imagine how thrilled and tickled my insides are today. Because I know by looking at her, it's just going to get better. I think the worst of the humps are over, you know? They're over. That's what I believe in. I believe in that she's already been healed. We're just waiting for the final product.
After 39 days in the hospital, JC is going home.
I miss you.
Go home and go night-night.
I miss you.
You have to have a sense of perseverance and tenacity. You really have to hang in there. How each family emotionally resolves this injury and how you help them to resolve this injury is an ongoing challenge. And I relish that. I just can't wait to see people get well and leave the hospital.
You outside, JC? Hey.
It's a matter of time of healing. She's going to be home for Christmas. And that'll be our Christmas present.